Hello, and welcome to another episode of Senior Soundings. I'm your host, Jerry LePage, and we are delighted to have you along today. Our guest is Senator Linda Ujifusa of Portsmouth. She represents Portsmouth and Bristol as well in the State House. Linda, it's great having you on, and I know you have some important information you'd like to share with our viewers, so take it away.
Thank you so much, Jerry. I really appreciate your invitation to be here, and I'm hoping that the viewers will find some of the things I'm saying educational. It's important to know that right now is the period during which you're able to make adjustments to your Medicare. The open enrollment period ends, I believe, December 7th.
December 7th,
And
yes.
so for those of you who are on Medicare or Medicare Advantage, this is the time you're able to switch. So it's really important that you're aware of some of the pros and cons of the programs. And I'm going to start with a 101 on Medicare and Medicare Advantage because it's confusing that the names are almost identical. And frankly, I'm finding that Medicare Advantage should be renamed Medicare Disadvantage because there are problems with it that are quite serious. And it's been illustrated most starkly in Rhode Island because in July, about 20,000 Rhode Islanders who had the United Healthcare Medicare Advantage plan lost in-network access for non-emergency cases to the 4 major hospitals in Rhode Island. And those hospitals were Rhode Island Hospital, Miriam, Newport, and Hasbro. And so if you had those, if you had Medicare Advantage plans with United, you could continue to see your doctors, but if they were ordering you to go to these hospitals, you would not be covered, meaning that you could go to them, but all the costs would be out of pocket for you. And that really disrupted care because what you would have are people who needed to have operations that were just about to get them, and then suddenly they had to be rescheduled elsewhere. And my husband is a primary care provider, Mark Ryan, and he's been an internist for decades, and he has had that problem with his patients. He's scrambling around trying to find them hospitals to go to and he's unfamiliar with them. So it's been quite disruptive. And I just want to clarify one thing. Some people thought that maybe United wasn't at fault in this, but I think that's not a fair characterization. United initiated this termination. Brown did not walk away. And I think Brown even offered to continue negotiations, but United declined. Mm-hmm. And so what is the problem with Medicare Advantage? Well, first of all, let's understand that at this point, you're being besieged by ads telling you how great it is, how you're a chump if you don't sign up for Medicare Advantage. Let's just start with 101. Like, what's the difference between Medicare Advantage plans and traditional Medicare? So, traditional Medicare was created in around 1964, and it is for seniors and certain other people with disabilities, but primarily seniors. And it had holes when it was created. It did not cover hearing and vision and prescription drugs, and so it wasn't perfect, but it was health insurance for seniors at a time when they were having, and we would still continue to have, trouble getting regular insurance. So it was a real blessing to get it. And unfortunately, rather than moving towards filling those holes in the program, in their wisdom, Congress decided to invite private insurance companies in. And what they decided to do is to offer what they call Part C Medicare Advantage plans. Now, if you purchase one of these private plans, it completely replaces your traditional Medicare.
Yes.
And the reason they're so attractive to people is that it simplifies things for them. Mm-hmm. They now have one card for everything.
Right.
And they don't have to buy a separate drug plan, a Part D. They don't have to buy a Medigap plan, which would cover limiting out-of-pocket costs. So it seemed simple. And here's the thing, you didn't have to pay hardly anything up front because it was basically almost free. So people flock to it. Now more than 50% of people who are qualified for Medicare are signed up for Medicare Advantage plans. So they're very popular. The problem is, as we've started to analyze what they do, there are tons of studies showing that the sicker you get with cancer or other very serious illnesses, the narrower the network is, meaning the narrower the doctors you're able to see or hospitals you're able to go to, and also the higher your out-of-pocket costs get because, and also they're able to institute a something called what they call utilization management,
right.
Which, you know, basically its ugliest form comes in prior authorizations. So your doctor has said, you need to do this, or you need to have these medicines, and all of a sudden your insurance does not cover it. And so you're stuck not getting what your doctor ordered. And a lot of my legislation that I've been working on in the State House has to do with getting rid of or limiting those prior authorization blocks to getting the care that your doctors and healthcare providers are requiring or saying you need.
And the bottom line, though, Linda, is with Advantage, as you pointed out, if you are chronically ill, it will end up becoming more expensive to have Advantage, even though on the face of it, as you mentioned, you can get away without having to pay an additional premium and still get coverage. But if you get into the weeds with the out-of-pocket expenses, you will end up spending more than if you had bought original Medicare.
That's what it appears from the studies.
Yeah.
And you can talk to people who have had, you know, it's a little bit it's not official studies, but I've talked to many constituents who've told me that they're facing huge medical bills.
Yes.
And I should point out that medical debt is the primary reason why people declare bankruptcy in the United States. And we're the only industrialized country in the world where that is the case.
Imagine that.
Imagine that. Why we have such a thing as medical debt comes from the fact that we do not have universal health, single-payer health care. And before I let this opportunity slip away, so one of the main reasons I got involved in politics is to try to help push the idea that we need universal single-payer health care. And what does that mean? Very basically, there are patients and there are providers, you know, doctors, and in the middle are health insurance companies, for profit mainly. And they take money from patients or taxpayers if they're funding Medicaid, and they give some of it, they pay some of it to providers. So they are payers. And again, every other industrialized country in the world has a single payer. And we, though, have hundreds of middlemen payers. And what that does is two things. One, it prevents us from negotiating as a country for drugs. And that's why you can get your drugs so much cheaper from a single payer state like Canada. It also creates this enormous amount of administrative burden that manifests itself in the fact that if you look at a chart of how the number of people who do administration, you know, the backroom paperwork to process your claims and whatnot, has increased by thousands of %, whereas the number of providers has been a couple % increase. And I know my husband spends hours every day churning through paperwork, trying to get his patients coverage, drugs, whatever. And it is causing, not just with him, but there's a thing called moral injury that is a thing among care providers, and that is that you have to spend more time doing insurance paperwork than you do taking care of your patients. And you often have to prioritize things that don't have to do with taking care of your patients because the insurance company is telling you to prioritize, oh, get them this drug, even though it hasn't been working. It's called step therapy. That's a type of prior authorization where let's try this cheaper drug first. Let's do this. You have to go through steps before you can get what your doctor ordered, even though there's proof that what the doctor ordered would be the most effective. So again, this is the problem with Medicare Advantage, that once you step into having a private insurance company manage your health care, you're in trouble. And so I would say, if possible, try to, you have this very short window, and I wrote it down. If you want some advice about moving back into traditional Medicare, again, it will cost you a bit more today because you have to pay approximately $250 per person for the upfront premium. But you can call 1-800-884-8721. That is the number for the State Health Insurance Assistance Program, also known as SHIP or SHIAP. Or you can call your local senior centers, and they can help you find impartial people to advise you about the best steps for you to get coverage as a senior, either through, well, preferably through Medicare, or if you have to switch out of a less desirable Medicare Advantage plan, they could also advise you about that. So that's my pitch during this period of constant advertising to take a Medicare Advantage plan that maybe Joe Namath is requiring you to have, right? So yeah, don't listen to the celebrities, listen to impartial people who will give you sound advice about your Medicare coverage. So that was one topic. I think the other topic, since this is a seniors directed show, I wanted to discuss a little bit about what the bills I'm interested in right now. And two big issues have come up, I think, that you might not think affect seniors, but the first one is Medicaid. And some people get Medicaid and Medicare mixed up. They arose around the same time in '64, but Medicare was for older people and Medicaid was for poorer people. And so a lot of seniors might think, well, you know, why should I care about Medicaid? That's not my big thing. But in fact, about 1/3 of Rhode Islanders get some coverage under Medicaid. And most of the people who are in nursing homes get some sort of Medicaid payments. And so what's happening at the federal level is that there has been a lot of fighting about funding Medicaid, and the way it affects seniors is that I call it the big ugly bill, is potentially cutting Medicaid payments significantly, and the states, so that Medicaid is a program that is partially paid for by state funds, state taxes, and partially paid for by federal funds. And right now, the shutdown was all about trying to make sure that the federal Medicaid funding was not being cut. And one thing people don't realize is that Medicaid also includes Medicaid expansion products, which also have names like Obamacare and insurance policies you can get on the exchange. And so what that means is that if you ever had a child that became older than 27, let's say, or you're someone, so they're no longer covered under your insurance, or you have a job that doesn't give you health insurance, or you just, so those are the two major buckets of people. They were able, under the Medicaid expansion, also known as Obamacare, also known as the Affordable Care Act. But what you'd see is you go online, you want health insurance, and you'd see bronze, silver, gold, platinum plans that you could buy. And it was kind of your only option for getting health insurance. So, many people signed up, and they don't realize that what they're fighting about in Washington is that when you signed up for one of those plans, if your income was below a certain level, the feds gave you a tax credit, so it wouldn't cost you so much. So if you're wealthier, you did have to pay the full amount, could have been like $4,000 or something. But if you were poorer, you wouldn't have to pay that much. So maybe your monthly payment was $1,000 or $500 or less. That's what they wanted to maintain. Well, as you all know or may know, that fight has ended, and it's still not determined how much of the benefit that you would be getting for those plans is going to come through for you. But the fear is that it could double what you're paying right now for these plans. Yeah. And so seniors, again, might think, I wasn't in one of those Obama plans, why should I care? Well, it's probably someone you know is in them.
Yes.
And then also, a lot of seniors are what they call dual eligibles, meaning that you are both able to be covered under Medicare and Medicaid. And so you're going to potentially have, anytime there are cuts in Medicaid, you will suffer as well, being both covered by Medicare and Medicaid. And again, many seniors who are in nursing homes have money coming in through Medicaid. So just be aware that that's a big fight happening. It's still, to be determined what will happen. My feeling is that as the big ugly bill puts holes in our budget, we have not too many choices. One, we could just let the cuts happen and all these expenses fall on whoever they may. That is one option. The other thing is to try to fight it at the state level to try to fill in those holes. But, frankly, we're running, I think, a $300 million deficit in our budget. So where is that money going to come from? It either is going to come from other programs that need to be reduced, and there'll be a huge fight over that.
Sure.
Or you could say, let's raise taxes. Let's raise the revenue that we're getting in the state. And I've been pretty upfront. I do believe that we should be taxing the wealthier folks in Rhode Island more, especially because a lot of the federal cuts that are coming are being funded by tax breaks for the wealthy. So if you're going to see wealthy people get, and I'm not talking, we're talking people with tens of millions at a minimum, and billionaires. If you're going to see people getting those kind of tax cuts from the feds, why don't we reverse the tax cuts that we've given to the wealthy to help fill the gaps statewide? And we can argue about the numbers. I think many people feel they're at risk of being swept into this, tax the rich thing because we're pretending they're rich even though they're not. Believe me, if you sat down and looked at the numbers, probably, 5 to 10% would be really swept in, and it's not necessarily a cliff where suddenly you have to pay a ton of money. It is going to be graduated, I believe. We need to see what the details of the legislation will look like. I'm not a lead sponsor on that bill, but I would be a supporter of reversing the tax cuts on the wealthy that the feds are imposing by putting tax cuts on the wealthy, by putting taxes on the wealthy in Rhode Island to pay for the cuts to our essential services. And so that is going to be an issue upcoming that will affect seniors, pretty big issue. One other way that we could, two other ways actually, that we could help fund healthcare for seniors that I've been pushing, and that is to go after the deep pockets, meaning who are people that are getting wealthy in our current system? It is the health insurance corporations and their subsidiaries. One of the biggest groups that health insurance companies are using are called Pharmacy Benefit Managers, PBMs. If you Google PBMs and Ujifusa, you'll find an article I wrote a few years ago describing who these folks are. I had no idea, but so what happens is that your insurance companies hire middlemen, hire contractors to manage your prescription benefits. And they used to just do simple things like take your prescription, make sure you got the drug, there was a flat fee, and they weren't very important. But all of a sudden, they've been elevated into this position of deciding which drugs are on the list of covered drugs for you. How much are we going to charge everybody for these drugs? So those tasks have started becoming so important that CVS, for example, was making more than 50% of their revenue from their PBM business. Is that sinking in? So it's a
Wow.
and the CVS Corporation, I think, was sixth or in the top, certainly in the top 10 of the Fortune 500 corporations with highest revenue. So they're beating, I don't know, all the really giant corporations that you could imagine should be there by making their money off of being middlemen. And so, believe it or not, the chasing down these PBMs because they've been making such enormous profits started in Ohio, a Republican-led state. And what happened is they had an auditor general who started, the newspaper there said, hey, it looks like these middlemen are making a lot of money. The government started looking into it, and they found that their PBMs were taking hundreds of millions of dollars too much out of their Medicaid system for what they did.
Wow.
And they did it with things like spread pricing, which means that Medicaid, taxpayer money, went to the middlemen, PBMs. They were supposed to give it to the pharmacists to pay for your drugs, but instead they were keeping a big chunk of it. And so the difference between what they were being paid and what they were paying the pharmacists, that was called the spread. That spread was huge, and frankly, violating Ohio laws, and they were brought to court, they settled, whatever. Ohio ended up hiring one PBM for the whole state. And so anyway, I was kind of inspired by that, started introducing bills that said, hey, can we try to do what Ohio and these other conservative states are doing to rein in PBMs? So a lot of my bills have to do with that as a means of lowering prescription costs, right? So going after the guys that got rich, that's another way of filling in holes and helping pay for our health care. And then the last way, which is kind of a new way, is to issue healthcare bonds. And people might wonder, what is a bond? Usually people think of, you've heard of road bonds and school bonds. They are to pay for infrastructure, right? So, and it's just like a mortgage is for you. Like maybe you have 30% of the money you need to buy your house. How do you get that other 70%? You get a mortgage, right? Well, a bond is just the state's way of getting kind of a mortgage to buy what they want. And so you need to fix the roads today. You only have this much money. Let's borrow the rest by asking for a bond, and usually a big bond like that that's backed by the government has to go before the public for a vote. Right. That's why you see it on a lot of your ballots. You have to approve this bond. Yes, that sounds like a good thing for us to do, because when we borrow money, as you know, you don't just pay back the exact amount. You have to pay interest. Right. So that's why we need approval for doing that. And so anyway, hospital bonds have not been a thing. And I don't know why. Well, they have been in one way, but not a good way in my mind. But if you look at what we do in this state, we do have a quasi-public authority that allows you to have bonds for schools and medical facilities. But they are not backed by the state. So what ends up happening is you help these healthcare facilities or schools borrow money, but they're ones that kind of can pay back without state help. So you're giving it to Lifespan and Brown, and you just have to understand you can't help distressed healthcare facilities. So Fatima and Roger Williams, the ones that they're threatening to close pretty soon, are having trouble getting that kind of bonding because they don't have any money. And then if you look at smaller places that are in trouble that might want help with their infrastructure, they are also not able to get, it's called RIBEC, Rhode Island Health Education, I think it's BC, I can't remember what the last name initials are, sorry, and I'm on TV too. But anyway, RIBEC loans don't help distressed facilities. So I'm just saying, what we should think about doing is having a bond, just like a road bond or a school bond, for healthcare facilities. And it's an expense for sure, but I think the need is as significant for hospitals right now, given that Fatima and Roger Williams are about to close. then is the need for roads and school buildings to have bonds. So I will be proposing we look into that right now. I don't think we can just have it happen instantly, but it would be nice to be able to think about putting that as a means of financing our failing healthcare facilities. And let's see, the other thing is, I want to quickly say what bills I'm working on. So they fall into some major buckets. For seniors, I've been working on the bills that two that are specifically senior oriented. One is a property tax relief bill that helps folks with their rent or their taxes who are seniors and who elderly and disabled, actually, people who can get a slightly larger tax credit. I'm working on a bill for family caregivers to get a certain tax credit. Also, I'm trying to help with physical therapy copays. I know we all need physical therapy, right? And the insurance companies are trying to put the copays up as high as for specialty care. And I'm just asking that they lower it to where you have primary care copays. So $35 instead of $70. Right. And also, so there's the physical therapy folks. There's also something called artificial intelligence, right? AI. Believe it or not, insurance companies are using this to deny claims, and they're doing it to the point where you could have thousands of denials in seconds without any human intervention. And so my bill is saying you've got to have a human being review these documents. You can't just throw everybody into a bucket and say, yep, you're all denied. Because when they've looked, something like 80 to 90% of those AI denials were reversed on appeal. And so there's something wrong there. And so we're trying to make it tougher to use AI, or that's one of my bills, making it tougher to use AI to do claims denials. Let's see, also claim sharks. They're guys that charge guys. They're companies that helped veterans get their pension benefits, but they charged thousands of dollars. And there are free services to help veterans get their retirement, their pension benefits. And so we just passed this bill to try to make sure that the claim sharks are going to be qualified and that people know about their options more. So that's another one. And I guess happy to talk about electricity bills and internet, because those are other bills I'm working on that would affect seniors. So,
well, we may have to have you come back to speak to us again because we're just about out of time, Linda. But thank you so much for your insights and all of the important information you've conveyed to our viewers today. And we hope you'll come again.
Thank you.
And thank you all for joining us here on Senior Soundings. Take care.
Thank you.